since May this year, was it last year, there's been an increase in circumcision deaths, but it seems like male circumcision is gaining popularity globally. And in South Africa, it is currently one of the most frequently performed surgical procedures in the world. Now, it has also been found that if circumcision can protect a circumcised man or a circumcised man's female partner from certain sexually transmitted infections. Now, many women claim that sex with a circumcised man lasts longer and offers more pleasure, and that they find it unhygienic to be intimate with a man who hasn't been circumcised. Now, that is what we hear. Now, to talk to us about this story, we're joined by Dr. Mpho Maraisane as the Deputy Director, Health Programs, HIV and MMC at the Aurum Institute. Doctor, very good morning to you and welcome.
Good morning and thank you.
Now, it seems like we do have some technical issues this morning in studio, but we can continue our discussion here. Circumcision seem to be very popular lately. Is it the fact that men are pressured by their partners, or is that just a normal thing that happens in society where people go through phases?
It's a bit of both. There's been a lot of messaging out there. The South African Department of Health included MMC in the milieu or the combination of HIV prevention interventions from 2010. And what has happened in that time is there has been consistent messaging of the benefits of circumcision to the men.
What are those benefits, Doctor?
So, as the name says, medical male circumcision. The main emphasis is HIV prevention. So we know that medical male circumcision can reduce the risk of a man acquiring HIV infection from heterosexual intercourse with an HIV-infected woman by up to 60%. More recent studies, and this came from evidence from Kenya, Uganda, South Africa, way back 2005.
Yes.
But subsequent to that, there's been more research that has even showed that the benefits goes beyond a single individual. There's a community-wide benefit.
How so?
In that, if you can think of it this way, if you have an individual who has averted HIV, or rather reduced their risk, in time, one individual and others, you end up with a level of HIV prevalence being a little less than it used to be. So in other words, where you have a background lower rate, you obviously in turn have a lower risk of acquisition, if that makes sense.
Yes.
So from individual benefit to community benefits. So that is the biggest benefit. There are other benefits. There are reductions in the risk of acquiring other sexually transmitted infections to the men. But in addition to that, we have benefits that accrue to partners, female partners of circumcised males. For instance, the risk of getting cancer of the mouth of the womb, cancer of the cervix, is that much more reduced in partners of men who've been circumcised. There are other benefits to men.
Yes.
We've recently known that the risk of cancer of the prostate gland is also lower in men who have had circumcision.
That sounds like a number of benefits if you're circumcised, but are there any negatives attached to it?
Okay. So, as you said, circumcision is a medical procedure. It's an operation. And as with any operation, there are potentially risks. But the important thing is, in the hands of trained, qualified, competent providers, those risks are minimal. So we do explain to the clients what the benefits are, what the risks are, like in any operation. But we would like to emphasize the fact that in the hands of qualified providers, the risks are minimal. So you have less than 2% risks of adverse events. And obviously things like bleeding. What should be emphasized is that if the advice that has been given to the individuals prior to circumcision is kept, that almost takes away all the risks that I have alluded to. So we get that preparation clearly to the clients before they go into circumcision to try and avert those complications.
Doctor, thank you so much for your time and joining us here in studio. Now, that was Dr. Mpho Maraisane. She is the Deputy Director, Health Program, HIV and MMC at the Aurum Institute. It's over to Eben with more.